It is a medical maneuver that can save lives, so-called proning patients. Flipping them on their stomachs can improve oxygen flow to their lungs and reduce mortality by 50%. But actually doing it is not easy. Proning patients can take more than 45 minutes and as many as 8 staff to manage tubes and oxygen lines and safely prepare the patient. And then there's the heavy, often injury-inducing lift. It's bed sheets and brawn, and all too often, bad backs. Just ask a nurse like Eleanor Kelly.
Even young nurses say your back is sore. We've had people off on back injuries. I have friends who have retired that they have degenerative disc disease now because of the lifting.
Imagine your 300-pound friend is on the picnic table and will not help you move, and you have to do it. If you want to understand what our nurses have to do every day, imagine that challenge.
And for that very reason, intensive care physician Stephen Bede wonders if proning patients isn't done as often as maybe it should be.
But there's been large studies that show that it was only used in between 15 and 35% of the people that it would be appropriate for. It is a demanding but important intervention that's done relatively infrequently. It has to be partly because it's just hard, and that's what got me thinking.
And before long, a little homegrown COVID innovation kicked in. After years at the bedside, Dr. Bede had a concept in his head for a device to make proning easier, but he needed an engineer to begin to make it a reality. There were months of marking and measuring, pitfalls and prototypes, and it became a team effort.
I didn't know anybody that knew how to make things like this. But an old friend worked in canvas, works with the Coast Guard and the military, and he had commercial sewing machines.
Nurses gave their input, how to make the device comfortable for the patient. It had to be cleanable and allow access to the front and back of the patient. And in the end, with the help of some designers and engineers in Montreal, this is what they ended up with.
Extremely strong Velcro, and basically it is a 2-piece blanket that attaches so that you end up with a method to open the back as well as the front.
Think burrito with Velcro straps. Yeah, it's not sexy, but it works. Remember the way nurses prone a patient now, the almost hour it takes to do it? Well, this new device, already on the bed when the patient arrives, hooks up to a hospital mechanical lift, which up until now could only hoist a patient up and down. It requires a fraction of the staff, and get this, only about 8 minutes to gently roll the patient over to the prone position or back again, and no nurses lifting.
My vision is that we will get to a point where nurses never lift again. That's what we need to do. We're using this to support our nursing colleagues through the COVID crisis, but they have a difficult job day to day, and we need to find a way to enable them to move patients but not injure themselves.
Oh, that would be a great world. I think it's possible. Like, when you think about it, it is kind of surprising that we didn't think about it before.
Dr. Bede has a patent on his invention, a one-of-a-kind, he believes, and the device is now in clinical trials at Halifax's QE2 hospital, where you couldn't fault occupational health and safety lead Angela Keenan if she cringed every time a nurse lifted a patient.
It's the driver of our not only injury rates within the organization, but actually it's the number one driver for our time loss claims as well for the organization. Game changer. Yeah, this is it's an innovative idea that's come from the front lines, from the experience of the frontline worker.
The front lines in the battle against COVID that might also help cure what has long ailed the healthcare system. Tom Murphy, CBC News, Halifax.